have patients on those medications, how are you tracking their weight loss? Is there specific metrics that you're using? And
so it has been a little more challenging with the pandemic because of the fact that more of our care is delivered virtually. So, patients not coming into, it used to be we would check their body composition, when they started the program, and then we'd follow it at least every 3 months, or, if they lost greater than 10% of their weight, right? It's not quite as important if they're maybe, gaining weight or something. But at the same time, yes, if they're doing the right things, right? Like if they report to us that they're following this meal plan and I'm going to the gym, I'm doing these things, then I'm going to want to check their body composition, because it might be, a shift in their, because a lot of patients will say, well, my pants fit better. Like I haven't lost that much weight, but my pants fit better, which, waist circumference has always been a nice, easy, inexpensive measurement, but it's hard to reproduce in the clinic, right? Different people doing it, different medical assistants, it's not the same one every time that you come in.
That can help measure or give you a proxy for their visceral adipose tissue, which is important for their cardiometabolic risk factors and their health in general.
Yeah, so I just had a patient today. She's done fabulous. She's lost over 100 pounds on semaglutide, and she was just, we were going through her body composition, and she was just so ecstatic, like seeing all those numbers, right? I think a lot of the times it's also seeing those numbers that help people stay motivated or get motivated, and especially if they can see that they lost, this much fat but gained this much muscle, right? And there's that differential there.
Well, it's always the worst if you have someone who's working really hard on the behaviors, which are what we really want them to focus on. If they're not seeing a number dip on the scale, that can be, quite unmotivating. So I think in particular for women, looking at sort of building or protecting that muscle mass during weight loss is important.
Especially, I think, with older women, right? And I say older, it's me. But people, over 40, over 50, when you start to lose muscle mass if you're not actually using it, right? And so I think seeing that number and seeing that visceral adiposity go into the normal zone, people are just like, it's life-changing for them to have that data in front of them.